Hi, I'm Vikas Patel, orthopedic surgeon here at the Orthopedic Institute of North Texas, and today I'm going to talk to you about rotator cuff tears. The rotator cuff is comprised of 4 muscles that arise from your shoulder blade and attach to the shoulder to provide range of motion. Rotator cuff tears can occur from wear and tear over time or after an acute trauma such as a fall. While symptoms may vary, most patients present with pain and weakness of the arm, and particularly difficulty with getting a cup or bowl from the cupboard. Some patients who have large tears or multiple tendon tears can have extreme difficulty even moving their arm at all, which we call pseudoparalysis. There are several non-surgical options available even if you do have a rotator cuff tear. Activity modification and anti-inflammatory medications can help alleviate the pain that are associated with rotator cuff tears. Physical therapy is a mainstay of treatment, as your therapist can help strengthen muscles around your shoulder to help compensate for the torn tendon. While traditionally steroid injections were given to help reduce the pain, we now know that the steroid itself can actually degenerate the tendon and lead to a larger tear and potentially loss of function. Also, we know that if multiple steroid injections are given, this can increase your risk of infection. If these non-operative modalities don't work, there are different surgical options available to you. The main 2 surgical options are either a traditional rotator cuff repair or a reverse shoulder arthroplasty. A rotator cuff repair is done in an outpatient setting and is done arthroscopically. This means that small nicks are made about the shoulder and a camera and instruments the size of a pen are inserted into the shoulder. We're then able to look at the tendon, clean it up, and repair it back down to bone using suture and anchors. The recovery process starts 2 weeks after surgery, when you will begin doing self-guided exercises at home. Physical therapy is a mainstay of treatment during the repair process, where your therapist will help you gain range of motion and your strength back. The strength portion, however, does not begin until 6 months after surgery, and most patients are able to fully recover at 1 year after surgery. The other option for a large, irreparable rotator cuff tear is a shoulder replacement. This is where your shoulder joint is replaced with metal and plastic, and your deltoid muscle takes over the function of the rotator cuff to be able to move your shoulder. This surgery requires 1 night in the hospital, and the recovery process begins at 2 weeks after surgery, where you start beginning to do self-guided exercises at home. Just like a rotator cuff repair, which is done arthroscopically, the recovery time for a shoulder replacement is also 1 year. If you have a known rotator cuff tear or suspect you may have a rotator cuff tear with pain and weakness in your shoulder, please call the Orthopedic Institute of North Texas today and make an appointment so we can help develop an individual treatment strategy dedicated just to you.